So we are here today, and this is the part 2 of the discussion in continuation of the yesterday meeting with Dr. AK. So we are going to discuss about the misconception about the homeopathy and what should be done to educate people to use this line of treatment. So my first question to you, Dr. Gupta, in which types of disease homeopathy is found to be most effective?
Well, as a matter of fact, homeopathy is good for all kind of diseases to be treated with homeopathy. But yes, as I always say, that every system has got something to offer and every system has got some limitations also. Yeah. So is the case with homeopathy also. Like we are, prominently treating the chronic diseases of all kind, whether it is of children, male, female, or elderly group. But certainly those diseases with the autoimmune disorders, they have got a more predominance in homeopathy. Allergic disorders, yes, and systemic disorders, yes. But there have been certain, what I say, the limitation is where there is a, pathology, irreversible pathology has occurred. There it find it difficult to treat them and cure them. But nevertheless, those patients who have been suffering from those terminal diseases and where they advanced pathology also, if homeopathy is not able to cure them or treat them completely, but definitely it helps them in palliating their problems. And it works as a complementary medicine to the conventional treatment, whatever the patient has been taking. So, there is no dearth of homeopathy in treating the type of disease. It treats all kind of disease, right from common cold and cough to even cancers and motor neuron disease, which is supposed to be, there are some diseases which are considered to be incurable or untreatable by allopathic system of medicine. They are also showing good response in homeopathy.
So suppose in certain cases, when you find the homeopathy having some limitations, do you suggest the patient to try other ways of treatment?
Well, normally, that situation very rarely comes when we have to say, but yes, if we find the necessity that the patient has to be hospitalized or patient needs an acute treatment with some other medication, we do not hesitate. Because as I told you earlier, our main aim is to the welfare of the patient without having any ego hassle. If the treatment is required with homeopathy, we certainly give, but we feel the necessity, the patient has to be hospitalized, he has to be managed in the hospital where certain procedures has to be done or where some oxygen has to be given, or if the patient has to be, dialyzed. So we do advise them, patient, to go in for that. But usually it is the other way around. The patient, those who are on, modern medicine treatment and having complicated problems, when they are getting the treatment for quite some time and they've been not responding completely favorably, especially the patients of cancer, those who have to be given chemotherapy or radiotherapy, and they get a lot of complications or problems, their body does not tolerate that kind of aggressive treatment. Yeah. Those patients, when they come to us, we give them a treatment on homeopathic treatment on a constitutional basis. There it helps the immunity of the patient and to tolerate the onslaught of chemotherapy as well as radiotherapy, and the patient becomes much better and he is able to tolerate, and his treatment gets completely with modern medicine. Same is the case with that in dialysis also. Those patients who have got a lot of variation in their blood pressure, headaches, vomitings, so they have to suspend their dialysis in between. Over a period of time, when we give them homeopathic medicine, patients are able to complete their course of dialysis, and gradually they are able to reduce the number of dialysis, or in certain cases they've been able to completely put off the dialysis also.
That's great. That's great.
Yeah.
So in the case of chronic disease, and suppose some patient is suffering from some disease, and he undergoing treatment in allopathy or Ayurveda. Do you suggest to combine the treatment with homeopathy, and does it show better results?
Well, this is very important question for the people to understand. Normally, if the patient have been taking any treatment, whether it is an allopathic or Ayurvedic, and if they are not getting complete relief or, as per their expectation, that is the only time when they would come to homeopathy.
Yeah.
So, but if we see the patient has dependent on those medicines, like there's a patient who's a chronic patient, CKD patient, there's a chronic cancer patient or chronic heart disease patient. So they have to be on life support medicines which are to be given. So we ask the patient to carry on without disturbing them. And gradually, once we start giving homeopathic medicine, as I told in the previous question also,
Yeah.
because the resistance or this, immunity level of the patient get enhanced with this homeopathic medicine.
Yeah.
So gradually the need of those medicines starts reducing. And we have seen in quite a good number of patients that they are able to, quit those medicines also, but certainly we do not say that immediately stop those medicines.
Yeah.
Simultaneously, we can treat. If the condition becomes better, then we can try to reduce the medicine gradually. And on this particular note, I would like to tell you one thing more, which is also very important. Those patients suffering from diabetes or blood pressure or thyroid or any other disease, they've been taking medicines which have been again considered to be continuous treatment for lifelong. Those medicines have stopped working. So they need to go to next generation medicine, the more potent medicine. So if that patient comes to us, we have seen in our own center of AKGsOVIHAMS Medical Center and other places also, number of patients have been able to get the same relief from the same medicine which they were becoming ineffective now. This has happened because the medicine, homeopathic medicine, which has been given to the patient on the basis of his constitution, it becomes again receptive to those same medicine which they were becoming reluctant or which they were becoming not reacting that way, where they're needing more potent drugs. Yeah. So this is also a very good effective of homeopathic medicine there.
Yeah. So it is advisable if the person is suffering from any chronic disease and he is undergoing treatment somewhere in homeopathy or wherever he wishes, he should combine treatment with homeopathy. And can you?
Well, as I told you in the beginning, yes, combining in a holistic manner and integrating treatment, if it is required for the welfare of the patient, yes, we do that. We do not mind, giving homeopathic medicine along with the Ayurvedic medicine, allopathic medicine and homeopathic medicine, depending upon the case. But not each and every case has to be done in this particular manner.
Because it has been my personal experience, because combining treatment, because like I suffered with this cholesterol and BP, and then the doctor told me you have to, whole life you have to just keep taking this medicine, only they are okay. So I did take the allopathic medicine for the good period of time, I think more than 6 months or a year or so. Then I took this homeopathic treatment also. And that was also, I think, for almost a year. Then after that, I tried this homemade medicine, like you say, the garlics and all that. And that all gave me very good result, actually, because after
That's what I'm saying. That's what I'm saying. Actually, the homeopathic medicine improves the overall vitality of the patient. So he becomes more receptive to any kind of a medicine which he's been not responding earlier. And at the same time, like a patient who's suffering from cirrhosis of liver, there's a person who's suffering from bad cholesterol, there's a patient who's having a skin problem, there's a patient who's having allergic problem. So he might be taking some medicine for some problem in allopathic manner, some Ayurvedic manner. But at the same time, he gets some kind of a allergy or some irritable problem situation are there, for which they come to homeopathic medicine. We give them medicine and that particular problem, it's been taken care of. And if they want, they can carry on with the those particular medicines of their own. And as a matter of fact, I would like to add on here that OVMs was the first ever center, that Homeopathy Institute of Homeopathic and Allied Medical Sciences, which was started with the basis of all systems under one roof. And where, as I told you, that that my belief is that every system has got something to offer with limitation. If we understand the limitation of our system, we can definitely include the other system for the benefit of the patient. Yes. And for that matter, my name is there in Limca Book of Records also. And we have got, this, Ayush system has come after that. So there is certainly a good scope for integration.
Yeah. That's my opinion also. However, I don't know whether this is legally allowed or not, or government is doing something or not, that I am not aware.
No. It is being looked upon. Even WHO has also started thinking in the terms of integration now.
Yeah. Okay. So my next question is, since, as you said, there are some limitations in every pathy, the way of treatment. Do you think there are some disadvantages also with homeopathy in terms of treating patients?
This is again a very important question what people should understand. Disadvantage or bad effects or side effects, homeopathy is, by grace of God, is free from them. We do not have got any side effects of medicines. We do not have got any adverse impact of the medicine, because the homeopathic medicine is given on this basis of similarity of the symptoms. If the medicine is not similar, it may not work. That's what it can happen, that the patient does not become better and his symptoms are not relieved. But it is very rarely you will see, or rather it has never been seen, that patient has taken homeopathic medicine and he had to suffer his side effects because in one form or the other. Here, that is why we say that homeopathy ensures health safely and surely. As I told you in the beginning, when we give the similar medicine, so there could be a little change or little aggravation which the patient may feel because of two similars are there. But that would be for a very temporary period, a very short period of time, and very soon it will finish off. And when with the law of survival of the fittest, if the medicine which is stronger, temporary, and artificial, the effect of the medicine goes, so goes the impact of that particular disease. So patient becomes disease free.
Okay. And
another. So in that particular manner, you can very easily, understand that ever since the inception of homeopathy, there has never been any medicine which has been taken off from the shelf or which has been banned because of its ill effects, its bad effects. So whereas which we keep on seeing every now and then in modern medicine, that such and such medicine has been banned in America, such and such medicine has been banned here, or it has been banned because of its side effects. Initially those medicines were considered to be wonder drugs, but later they have been seen that they have got a lot of side effects, so they have been withdrawn. This has never ever happened in homeopathy. The same medicine which was started at the time of homeopathy's inception, those same medicine are being continued to be used, and with good relief.
That's good. And many people are in the habit of, since they know there is no side effects with homeopathy and there is no reaction, so they are in the habit of just keeping some medicines at home and using it whenever they feel the need. So do you think this is advisable?
In a way, as we say that this is blessing in disguise, that homeopathy does not have got any side effect or bad effect. So it doesn't really matter. But still, I would never advise that patients should take medicines on their own, because medicine is a medicine. If it works, it helps, it reacts, it does cause some kind of a discomfort to the patient for a while. But why should it be given and why should it be taken unnecessarily? So medicine should never be taken unnecessarily, whether it is homeopathic, allopathic, or Ayurvedic. It should be always taken with under the advice of a qualified physician, doctor of that particular regime. Or self-medication is more harmful. And to tell you honestly, there are people who have been taking homeopathic medicine. This is again, it's a very important question. Like somebody has taken Nux vomica for the problem of constipation.
Yeah.
So whenever he feels constipated, he takes Nux vomica, he feels better, it's fine. But there is another patient who has diarrhea with the symptoms of Nux vomica. So we give the medicine Nux vomica and his diarrhea becomes all right. And those two patients, they advise to their friends and relatives, or I mean, common one, if you have got diarrhea, take Nux vomica. But his other friend says, no, this Nux vomica is taken for constipation. So this causes a problem.
Yeah.
So it should never, because medicine, one homeopathic medicine is not meant for one particular problem only.
Yes.
It can treat number of diseases, number of symptoms, number of problems. And it is that is why we say that homeopathy is scientific and art in practice. This is the practice, is this how to use which medicine where. That is an art. How it works, that is definitely scientific. So the same patient of Nux vomica gets treated and become all right if he has got diarrhea. The same, another patient who is also a Nux vomica patient, even if he has got, constipation, he becomes all right. So never to be taken the medicine Nux vomica for constipation or Nux vomica for diarrhea. If the symptoms match, symptoms are calling for Nux vomica, then it will work for both, whether diarrhea or constipation.
Yeah, and I have a conception, as I know, whatever medicines are there in homeopathy, most of the medicines are there in one group, and a few medicines are there in other groups, and both the groups are not supposed to be mixed. I just learned from someone who knows a little bit about homeopathy.
Okay.
So I just wanted to clear my doubts. Is this correct?
Well, let me tell you. See, what happens is, firstly, as you said that you, got this information from somebody who knows something about homeopathy. So it's not an, homeopathic expert or homeopathic thing, but yes, it's a question which is a valid question. What happens is, we call, as we believe in that every medicine has got its own pathophysiology. One medicine given in one group, like there's certain medicine which are being made from the plant kingdom, some are from animal kingdom, some are from mineral, and there are certain medicines which are inimical to each other.
Yeah. So they told me actually, these both groups are never mixed. If you mix these two medicines, the reaction is very aggressive actually.
That's what I'm saying. We call it the inimical. Like Bryonia is one medicine and Restox is another medicine.
Yeah.
Mixing of that, usually in homeopathy, there is mixing is avoided as far as possible.
Yeah.
Most of the time, it is a single remedy, or it is a remedy which are given one after the another. But mixing of medicines are done, but in a few cases, but with keeping these things in, knowledge of that, that these things are not done, which are inimical. So if they are inimical, so they will not give any action or per se what you wanted. So there will be, you fire a shot without any, it's in the air, but it will not shoot your target. But if you're targeting, something with the proper medicine, it will definitely have the target and it will work over there. So if one is coming from this side, the other is coming from this side. So there may be a confusion that this medicine is going to work or this medicine is going to work. And there's a possibility that both the medicine make another A plus A and A, that make 2A, that make an A square, that can A plus. The reaction could be different. So the outcome could be different also. It is usually, homeopathic remedies given which has been done under the drug proving. If you are making two drugs together, so there is no drug proving done on that. So there is no symptomatology known. You are just making by a combination by your own personal experience. Yes, if there's some combination has been made and that has been drug proved and given trial on the people, healthy human beings, yes, then there may be some different set of symptoms, which could have been some symptoms of A, some symptoms of B. And then, I mean, we can, but consider that could be a new remedy with this type of symptoms. So not it is only the combination, it can be taken as a new remedy.
Okay.
Okay? Yeah.
So there is no negative effect, only thing this will be ineffective. That's what you're saying.
By and large, yes. By and large, it is ineffective. Yes, in very severe cases, I mean, if the patient is very, very sensitive and I mean, what we call his sensitivity threshold is very high, the patient may show some symptoms of the drug.
Okay.
We call it like, I mean, over a period of time, you have to keep on giving something regularly, then patient may show few symptoms of, I mean, that drug also.
Okay.
Whichever drug we have given, yes.
Now, my next question is, see, as we are discussing about the misconception and ignorance of the general people, there are a few diseases that someone has from early childhood, like stammering or something, and they think this is a defect from the birth, so this won't be cured, and they never try any medicines for that. And so do you think the effective in such cases, like one example that is coming to my mind is just stammering, and there are many other things, or people think
Well,
like
yes,
that.
yes, very nice question. And let me tell you and make it very clear, homeopathy has got a very good response in treating such kind of patients, whether it is a stammering, what is it like the cases of ADHD, cases of, I mean, you have problem, OCDs and all that. Those patients with the congenital disorders, also, some patients have been improved to a greater extent. Stammering is not only the physical, it has got a mental or psychological aspect also.
Yes,
so
yes.
you need to see the underlying factors. There have been cases, the patient who had been absolutely all right, after a certain period of time, they start stammering because of certain situations happening in their life. And initial cases like that, I mean, you would say, if not stammering, but they're mispronouncing. Like there are children who called ka ko ta. They, instead of saying kala, they say tala.
Yeah.
Or so it is the basically where we need to give the medicine, and we need to give a speech therapy where the articulation of the tongue has to be improved.
Yes. Yeah.
In addition to the medicine, you need to give them a lot of practice, and that practice has, I mean, I've got number of cases, I mean, where this I mean, problem that they used to think was totalata hai. So it is a problem, the childhood problem, it will not go. So they reluctantly, they came and they found it to their, I mean, pleasant surprise that the problem was completely gone. I mean, 2 days back only, I was having a child, I mean, who was having a problem, and they say like, bolna nahi aata, isko bolna nahi aata. Then I asked slightly, because he was not able to articulate his tongue, so he was not able to produce those sounds. So when the moment I pushed it, I mean, from the one side and asked him, and he could very distinctly say the same word in front of the parents. So they were parents who were ever flabbergasted. I mean, and he was a child, was around, I mean, 12-year-old. So this what happens, because like that is what we say, that in homeopathy we need to have the, I mean, kind of an observation. You need to see the patient in totality. What is to be treated, and quite a good number of times it is there that you don't need any medication, you just need a right kind of an advice and right kind of a management. So without medicine also it can. So, but in a wholesome, you need, when you are coming as a physician, you need to see the things in a totality. That's what we believe in. That's what I do in my practices.
Yeah. So similar is the case with the body growth, because in the early days that some kids don't gain heights, and
yes, like those people who got a stagnation of height. I mean, because of we need to check those. I mean, the parental history, how are they, and their hormonal history also. I mean, child has to be seen from that angle. Like there's, I mean, a question of we call dwarfism, or there's a patient who will come and have a problem with the thyroid and all that, the growth hormone is not taking place properly. So you need to evaluate those things in a proper manner and give medicines and give proper advice and give proper management. Yes, patient, they do, become well and respond pretty well.
But in general cases, do we think in the early days, if some medicine is given to the cancer?
Yes, I have, a number of families where those parents, which are very enthusiastic now, everybody wants their, daughters and sons should be, long enough, either should be Deepika Padukone or Amitabh Bachchan. So, and they come and say at the age of, 3 or 5, Doctor, isko dawai de do, taki iski height lambi ho. I never do that.
Oh.
And what I tell them, let us see their natural growth.
Yes.
If their natural growth, which gets suspended at the age of 10 or 12, then probably we might need to give. But I have never ever, given medicine for the patient, even if the patient have been asking. I said we do not want to hamper the natural growth.
Yeah.
We must, appreciate and let the nature take its own place. If it gets suspended at the age of 10 or 12, or by the time girls they start, adolescent period, that time, yes, you can give the medicine which can stimulate those growth hormones and growth other things, and that, yes, definitely it helps also.
So tinkering with the natural process might have some side effects in somewhere else.
Well,
in terms
yes, it can happen. Have some impact, but I personally do not like to interfere with the natural process of the body.
Yeah.
It is always advisable to let the nature play its own role, because medicines are medicines, as I earlier also said. Even though homeopathic medicines are not, going to cause any adverse effect, this is everybody knows. But still, why to give that if it is not required?
Yes. So we are coming to the next question. Okay, in many cases today we see in general in society, the allopathy is the first line of treatment. If any person gets any disease, any ailment, they will go to the hospital only. They hardly think of trying the other pathy, Ayurveda, homeopathy, anything. And in some of the cases, when you go to the hospital, the only treatment they have the operation. If you get prostate, they will advise operation. If you get many cases, I think, even the normal thing, even in the cases of childbirth or something, most of the cases you go to the hospital and they will advise you operation, and they'll give you any reason and you won't be able to counter them. So do you think in such cases, the people, when the operation is advised to them, the people should try other pathy of medicine before going for the operation?
Well, yes, it's very important. See, surgery is a very advanced branch of modern medicine, which we do not deny. We appreciate that. But yes, I would call surgery should be taken as a last resort, not as a first thing. Like the cases, patients, young children who've been having recurrent tonsillitis or adenoids, they've been operated. I think those patients, we have got number of patients, those who were advised operation by the, ENT specialist and all that, and we treated them patient completely. Their adenoids have gone, their tonsils have been all right, and they've been perfectly all right. And now they're around 20, 30, and 40 years of age without having any problem. Same is the case with the patients who are having piles. Like they say, like you have to be treated of. Piles are also can be treated of without medication, without surgery. Even the patients of fibroid, we have got number of patients at our clinic where the lay doctors have told them that you need to go in for hysterectomy, and those girls they never wanted, or the ladies never wanted, so we treated them off. We treat, though it depends. On the not each and every case, I would say we have to be selective. We need to see whether the patient is going to be treated properly with homeopathic or not. There's this comes with an experience, and we have treated the patients, and those patients have become all right. We send them the same patient to the gynecologist, and now they say now there is no need of operation. So this kind of a thing is very good, but use of surgery I'm not against, but yes, I'm definitely against the unuse or abuse of surgery for commercial gains.
Yeah,
Commercial gains, yes, that is the one thing which is very unfortunate, but it is happening.
yeah,
Secondly, the judicious use has to be taken for the surgery. As I said, there is a very thin line. If you have advised a patient for surgery, who could have been treated with homeopathic medicine, that is wrong. But there is a patient who needed a surgery and you're not sending a patient for surgery, that is also wrong.
yeah.
Because both ways you're not doing the right thing for the patient.
Mm-hmm.
It is either because of your negligence or
Mm-hmm.
because of your personal interest. These both the things should not be done neither for the personal interest nor because of the negligence. So one should be able to treat the patient conservatively as far as possible. Surgery should be used as a last resort.
Because this is very much in practice, and you go to the hospital and they will advise surgery, and they will advise you very aggressively. You have to go for the surgery immediately without delay. So that is a very
Well, that's a very unfortunate part because there's a fear component which has been created. Again, if you don't get it surgery, it might turn out to be cancer.
mm,
Under the fear of this, people go and succumb to those things.
yeah.
Whereas, like many patients of stones, they said the only surgery is the only answer. But no, this is not the case. We have got thousands and thousands of cases of renal stones, ureteric stones, bladder stones. They have been completely treated off with homeopathy without any surgery. So there are certain things where I can say that homeopathy can be tried for so-called surgical cases:
Mm,
tonsillitis, adenoids, piles, warts, uh, tumors, uh, what you call fibroids, even clasion. You must have seen a lot of patients having clasion on the eyes, and they say they need the treatment. Surgery. We have treated number of cases of clasion without even having a slightest. Absolutely, styes and all that. So there are a number of cases of abscess where they have to be drained. So those cases have been taken care of with homeopathy properly without any giving any incision. And for that matter, if you go to my website, you can see number of cases. That's www.ovms.com, where number of so-called surgical cases have been treated with homeopathy. Those who were advised surgery, and they could get completely all right without being operated upon. So that's a big achievement for homeopathy too.
so, sir, with this, I'm coming to my last question actually.
Okay.
Because this is my experience that we see in our society. Your people's health in general have deteriorated considering the life of 30-40 years before. So in general, people get more disease and their immune system is also not so responsive the way it was earlier. So people get more and more diseases. So, and after this pandemic, the people have also become very conscious about their health because the experience they have got during this pandemic. So, what do you think are primary causes of this phenomenon actually? They are
Uh,
getting more and more disease, and
the
how
the
homeopathy can help them?
the biggest and most important thing is the lifestyle. The changing lifestyle of the modern society is the biggest culprit.
Yeah.
Rest, the culprit is your plastic. Use of more and more synthetic things,
Yeah.
whether in the form of food,
Mm.
medicine, clothes, and environment. Synthetic is the biggest culprit of today's problem.
Mm.
And the worst scenario is the adulteration.
Yes.
Adulteration in food, adulteration in medicine, because they are using things, like artificial colors, putting oxytocin injections. So they are basically making the society weak and unhealthy and diseased. A lot of carcinogen and elements are being used in this, I mean, your food items and your medicine kind of things. And over a period of time, I mean, the kind of a stress, the psychological impact is also taking a toll on, I mean, people's health. After the pandemic, though people have become a little more conscious, there have been cases post COVID as well as post vaccination. They are also having the impact of those disease, I mean, thing in the form of skin problem, in the form of neurological problem, in the form of this. So over and all, I think we need to think healthy, remain healthy from the mind, body and soul. You have to be pure, go towards the nature, do meditation, avoid, I mean, faulty lifestyle, and live happily and happily with homeopathy also.
So, sir, we have only 2-3 minutes left. So, to remain healthy, to lead a healthy life, their behavior should change, their food habits should change. However, I think the food is a very big thing actually, because we hardly get anything pure in the market, because whatever is available in the market, only those things.
You don't have got the pure air, you don't have got the pure water, you don't have got the pure food. So how do you expect a good health?
Yeah, definitely. So whenever I suggest to my audience, whenever you have some problem, I think the first thing you should try homeopathy. This is a very holistic way of treatment. Try homeopathy. If you are not getting well, only then you try some other pathy for your any disease or something.
Sure.
So this is the thing. I think we have hardly 1 minute left. So I just
yes, the one thing I would like to say, homeopathy ensures health safely, but health comes in a package. Health comes in a package. To do everything in a moderate manner, excess of anything is bad. This you should always, I mean, whether if you keep sleeping all the time is bad, if you keep working all the time, that is also bad. So keep a moderate and adopt the moderate side of the life. So work, do meditation, give rest also, exercise also, and above all, remain happy and produce more love and affection towards your nature and with your, I mean, fellow colleagues. The more affection you get from the people and the more affection you give to the other people, that also produces a good, healthy atmosphere. If the healthy atmosphere is there, you are likely to remain healthy.
Thank you so much. It was so nice talking to you. This was a very inspiring and very knowledgeable session. This will help many people. So friends, we are coming to the end of this session. Please, if you find the video useful, please like the video and share the video to spread the message. And we'll be meeting again. Please subscribe to the channel.
Thank you.
Whenever I upload any video, you'll be getting notification for this. Thank you, sir.
Thank you
so much.
Thank you. Thank you. Thank you very much. Thank you.